Measures were taken to protect the elderly and the most vulnerable while the virus spread among the healthy and developed herd immunity. And the numbers show a slow viral spread, a fairly low death toll, around 700, but there are warnings. Those numbers of confirmed cases and the number of dead are expected to rise significantly. On Tuesday, during the coronavirus White House briefing, Donald Trump called out Sweden for this more lenient approach.
Now, they talk about Sweden, but Sweden is suffering very gravely. You know that, right? Sweden did that. The herd, they call it the herd. Sweden is suffering very, very badly. It's a way of doing it, but everybody has been watching everybody else. And so far, almost every country has done it the way we've done it. We've chosen to do it. If we didn't do it that way, we would have lost hundreds of thousands of more people, okay?
Joining us now from Soccer Foreign Affairs, Lind, good to see you. Ms. Lind, thank you for taking the time. Can you clarify for us right now the situation in Sweden? Would you say you're suffering greatly about the death toll and the infection rate? It seems relatively low compared to many other countries.
Well, thank you, John. Glad to be here. Actually, we are suffering like many other countries, but there is a lot of myth going on about the so-called Swedish strategy. And as you just heard Donald Trump saying that we have a strategy of herd immunity to respond to COVID-19, and that's absolutely false. That is not the Swedish strategy. We have a combination of recommendation and legally binding measures that is followed by many of the people. For example, we can now see in Easter that there is a 90% decrease from Stockholm to some of the most popular Easter travel places. And we also have more than 90% of the people who are more than 70 years old who stay at home and follow the recommendation. Then we also have legally binding measures, like, for example, it's forbidden to go and visit any elderly home. We have also no more than 50 people can stay. Our goal is the same as in most other countries. We want to save lives. We want to hinder the spreading of the virus. And also, we want our health care system to be able to cope with this extraordinary challenge that COVID-19 is.
There seems to be sort of a basis here of trust. Essentially, you're trusting the population to do the right thing without mandating some draconian shutdown. At the same time, the population is trusting the government to provide adequate health care for when they become sick.
Yes, actually, the system we have, which we have had for 300-400 years, is that we have rather small ministries but rather big authorities. For example, the Public Health Agency is such an authority. And there is a high level of trust between the people and the authorities and towards the politicians, but also the other way around. That when there is a recommendation from the Public Health Agency, there is a very, very strong urge to follow it from the population. So that is why in our case, and I have to say this is our way of doing it, we don't need to have the legally binding measures because we can trust people to follow recommendation to a very big degree. We also have made it possible for people to stay at home. We're taking away the qualifying day for sick leave. We have raised the money you get when you are unemployed. We have also seen to that the healthcare system get what they need. So we try to make it easier for people to stay home and not lose out economically on it, at the same time as the healthcare system should have the things that they need to fight this disease.
It's a system with more carrots, I guess, than sticks is one way you might put it.
I would say so, yeah.
What is the impact, though? But it seems like there's a lot more encouragement for people to do the right thing. What's the impact, though, when you have the President of the United States, from the loudest ruling pulpit on the planet, essentially spreading misinformation about Sweden? What does that do domestically and internationally?
Well, of course. I mean, I'm very sure that the United States it's fighting this disease in a way that is appropriate for the United States. But I have to react when there is an actual, factual wrong saying in what President Trump is saying. We do not have a herd immunity strategy in Sweden, and we are not. It's a myth that life goes on as normal in Sweden. And I have to try to get out and tell everybody we are also trying to save life, to hinder the spread, but not in that. When President Trump is saying so, that is factually wrong.
Very quickly, do you expect restrictions, tougher restrictions, to be put in place fairly soon?
Actually, we have made it possible to do it, and we are saying we want the right measures, but also in the right time. So we haven't closed down our schools. We have closed down with distance education from secondary school and universities. Would it be necessary, we would do it. We are not hiding away as government of taking legally binding measures if we think that is more effective. We also think that if we have taken a bigger lockdown, then it would have been more difficult to people to do that on a long-term basis. And we think we still have a long term to go.
Yeah, I think you're right. I think there's a very long time for all of us before we get through this. But Foreign Minister Ann Linde, thank you so much. We appreciate your time.
Thank you.